Hey everyone, welcome back to another episode of Tech Podcasts, Dev Technosys. I'm your host Yash, and today's topic is one of the most exciting developments in modern medicine: artificial intelligence in healthcare. From diagnosing diseases with higher accuracy to improving patient care and reducing clinical workload, AI is transforming how healthcare systems operate, and the change is only accelerating. To help us break this down, I'm joined by Dr. Emma, a researcher and consultant specializing in AI applications in medicine. She's worked closely with hospitals, AI startups, and healthcare app development teams like those at Dev Technosys. Emma, welcome to the show.
Thank you, Yash. I'm thrilled to be here. It's such an important conversation, not just for doctors and tech folks, but for patients and everyday users of health systems.
Absolutely. So let's start at the very beginning. For those unfamiliar, what does AI in healthcare actually mean?
At its core, AI in healthcare refers to the use of algorithms and machine learning models to analyze complex medical data. That includes diagnosing diseases, predicting health outcomes, personalizing treatment plans, automating administrative tasks, and even assisting in surgeries. We're talking about machines learning from data, past cases, scans, symptoms, and making decisions or recommendations that help medical professionals do their jobs faster and more accurately.
So it's not replacing doctors, it's enhancing what they can do.
Exactly. AI is a tool, not a replacement. Think of it like a super intelligent assistant. It helps doctors catch things they might miss, reduces diagnostic errors, and allows them to focus more on patient care and less on data crunching.
Interesting. What are some of the biggest areas where AI is currently being used in diagnosis?
There are several key areas. Let me highlight a few.
Radiology and imaging. AI tools can now analyze X-rays, CT scans, and MRIs faster, and with accuracy comparable to, and sometimes even better than, radiologists. For example, detecting early-stage lung cancer or brain tumors. Pathology. AI models analyze tissue samples to detect abnormalities like cancerous cells. This has huge implications for speed and accuracy in labs. Cardiology. Algorithms can analyze ECGs, identify heart arrhythmias, and even predict potential cardiac events before they happen. Dermatology. AI-powered apps can scan skin conditions and suggest potential diagnoses, useful in remote areas where dermatologists aren't available. Ophthalmology. AI is helping screen for diabetic retinopathy and other eye diseases by analyzing retinal images. And that's just the start. We're seeing AI move into nearly every specialty.
That's amazing. Now, let's talk about the patient side. How is AI improving patient care directly?
Great point. For patients, AI is making care more proactive, personalized, and accessible. Here's how. Virtual health assistants. Chatbots and voice assistants guide patients through symptoms, offer medication reminders, and answer health-related questions. Remote patient monitoring. AI analyzes data from wearable devices to alert doctors if something seems off, like a sudden drop in oxygen levels or a regular heartbeat. Personalized medicine. By analyzing a patient's genetics, medical history, and lifestyle, AI can recommend treatments tailored to them, improving outcomes. Mental health support. AI-based apps detect emotional patterns through speech and usage behavior, offering interventions or notifying therapists. Faster triage. Apps can pre-screen symptoms and guide patients to the right department, saving hours in waiting rooms. The result? Patients receive faster, more accurate, and
Sounds like AI is really about turning healthcare into something continuous and connected, not just episodic visits.
exactly. It bridges the gap between appointments, allowing healthcare to be something that happens with the patient, not just to them.
Let's shift gears for a moment. What does it take to develop an AI-powered healthcare solution? Let's say a hospital or health startup wants to build one. What's the roadmap?
That's a great question. The roadmap typically looks like this. Define the use case. Are you diagnosing, predicting, or assisting care? For example, early detection of sepsis in ICU patients or medication adherence tracking. Data collection. This is crucial. You need access to quality, annotated medical data, imaging files, EHRs, vitals, and it must be ethically sourced and compliant with data privacy laws.
Testing and validation. Clinical accuracy is critical. The model must be validated against real-world scenarios and benchmarked against medical standards. Regulatory compliance. Depending on the region, you need to comply with HIPAA, FDA guidelines, CE marking, etc. Integration and deployment. Finally, integrate the AI engine into a usable app or hospital system with intuitive UI, alerts, dashboards, and patient portals. This is where teams like Dev Technosys come in, combining healthcare expertise with technical development and compliance know-how.
That's helpful. What about challenges? What makes AI in healthcare harder than, say, AI in finance or retail?
Healthcare is unique because lives are at stake. A wrong recommendation can have serious consequences.
Data privacy. Medical data is highly sensitive and must be protected at all levels. Data complexity. Medical data is unstructured, handwritten notes, inconsistent imaging, varied formats, making it hard to standardize. Bias in data. If the model is trained only on data from one population, it may not work well across different races, ages, or genders. Clinician trust. Doctors must be able to understand why the AI is making a decision. So, explainability is key. These challenges are why healthcare AI solutions must be built with ethical design, medical input, and regulatory oversight.
Absolutely. Before we wrap, I want to ask about the future. What's next for AI in healthcare?
We're going to see a few things evolve quickly. Real-time decision support, AI tools that assist doctors during surgeries or live consultations, offering insights on the go. Predictive public health, AI models predicting disease outbreaks or healthcare resource needs based on population data. AI doctor collaboration, AI will work side by side with clinicians, not just in diagnosis, but also in documentation, billing, and treatment planning.
Global accessibility. With AI, quality healthcare can reach rural or underserved areas via mobile apps, smart kiosks, or even AI-powered drones delivering medicine. The big picture? AI won't just optimize healthcare, it'll democratize it.
That's a powerful way to close. Emma, this was an eye-opening conversation. Thank you so much for sharing your insights.
My pleasure, Yash. Always happy to talk about building a healthier, smarter world.
And to our listeners, if you're working in healthcare or planning to build an AI-driven health solution, now is the time to innovate. Visit devtechnosys.com to explore how we help hospitals, startups, and health brands bring their AI-powered platforms to life securely, ethically, and at scale. Thanks for tuning in to Tech Podcasts by Dev Technosys. I'm Yash, and until next time, stay healthy, stay curious, and keep building a better future with tech.